Welcome to the Objective Recovery podcast. Today we will speak about why healthcare systems don't operate optimally and what we can do about it. My guest is Dr. Apurv Gupta, a transformational healthcare executive with over 2 decades of experience leading clinical innovation and organizational performance improvement across the healthcare landscape. Dr. Gupta has a background in internal medicine, public health, and policy, and recently founded a Loving Organization movement with a mission to redefine healthcare through improved values, clinical outcomes, and engagement. Apurv, I know you from a Loving Organization, and it had a very positive impact on me from the beginning and what we do at Objective Recovery. So it's already an influence. So first of all, thank you for that and for taking the time today.
Oh, my pleasure. Yeah, thank you, Henrietta, for being a charter member with our consortium from the beginning. I remember a year plus back when you were involved, back in the day when we were just about to get started, and you actually did one of our first live streamings, to coordinate that so that we could get the message out. So I really appreciate everything that you've been bringing to the effort. And I think, as you and I were just discussing before we started recording, it's so gratifying to see how many people have now come into the movement and how that movement continues to gather momentum.
So let's discuss the details of that. But before we get there, I just want to say that you have had an impressive career in healthcare leadership. So why do you think people complain so much about healthcare? We see it all over on the online, in person, everywhere.
Well, that's a difficult question right off the top. Why do people complain? I think there's probably a number of reasons why people complain. But let's start with the fact that now healthcare is about 20% of the GDP. So it's a very, very big industry, which means that it's really complicated. There's multiple different parts to the healthcare industry. So it's not like one part of it that you can just look at. You have the payers, you have providers, you have outpatient and inpatient, you have mental health and physical health, and then you have the rehab. And then, of course, you have all the life sciences companies and regulators. So it's a very, very complex system, which automatically means that it's hard to operate. I mean, you really have to understand how to work with complexity. And unfortunately, most of us really haven't been trained in dealing with complexity. Probably most of us, the average person, the average executive you ask now, really hasn't learned too much about complexity leadership and adaptive leadership. So I think that that's part of the challenge, is trying to think of this as a relatively complicated problem or a simple problem that we're trying to solve by breaking it down into parts. That's generally how we learn problem solving as we grow up and through school and through our training. We learn to break things down into smaller pieces and then try to address them, which is always a good problem solving strategy. But when you're dealing with something as holistic and as complicated as healthcare, you have to realize that you have to sum everything up together again, so that it can actually address the overall holistic nature of people. Right? We can't just take care of someone's stomach or someone's heart. We have to take care of their whole body. I know this is something that you're a big believer in, and why we're having this conversation. It's really, so I think that's number one. The second part of it is, I think it's feel like we should be getting more out of our healthcare than what we do. We're constantly comparing ourselves to other countries that are way behind us in terms of how much they spend, maybe 10% or 12% of GDP. Many others don't even break the double digits. And they, quote unquote, are getting just as good, if not better, outcomes when we look at public health related outcomes like maternal morbidity and child-infant mortality and all that kind of stuff. We have other countries that seem to be getting it right, even though they're not spending as much. So that also creates a lot of challenges. I think in general, if you start digging into your question a little bit deeper, and you say, well, why are patients unhappy? I think it's because patients feel that they are being treated in parts rather than holistically. So you have to go to this doctor to see them for your endocrine problems, and then to another doctor for your kidney problems, and then to another doctor for your heart problems. But no one is really looking at the whole thing because no one really has the time or the incentive. You may not have a primary care doctor, or even if you do, they may be overwhelmed. So from a patient perspective, it feels like it's a disjointed care. And the patient or their advocate has to piece together, the parts of it. That's not very satisfying to the patient or the advocates. And then on the clinician side, they similarly feel like they're just on the treadmill. Nurses and doctors are running as fast as they can to carry the patient loads that have been given to them. And it's really difficult for them to make those patient loads work when the overall systems that they're a part of are not really conducive to helping them out. So, I'm sure we could probably have an hour-long conversation on just this conversation about why people complain. On the flip side, Henrietta, you and I, we know that there are many things about healthcare that are good and that are working. Healthcare in America is still considered to be leading edge, innovative. People come from across the world here when they want their cutting-edge care. And we know we have access to the leading medications and treatments and doctors. And so there's a lot of great science and innovation that's going on here. So we know that there's positives as well. And then we know that there's movements like ours, many movements like ours that are out there that are trying to figure out how to make it work.
Thank you for this balanced view. I completely agree with you that it's not all bad. My impression is that in general, healthcare providers in healthcare, people are trying to be more collaborative these days, but still they established collaborations, but they still don't communicate enough. As a patient, I see this also.
Yes, it's more of the disjointedness. And, when we talk about interdisciplinary care, we talk about, team-based care. Some places have been able to implement that, but it's still a struggle with many different health systems and hospitals. Still struggle with trying to get the doctors, nurses, therapists, pharmacists, patients, their advocates, everybody to be in the same team together. It's still considered to be a relative, innovation at this point, or at least a cutting edge of performance improvement where people are trying to get to. I think that that's really essential, to helping solve part of the challenges. Some organizations have done a really good job of making sure that when a patient comes in, they get to see all the specialists at the same time, such as Mayo Clinic. It's always used as that one example where they really pride themselves on their collaborative care model. So it's models like that really are necessary for us to implement. Even if we can't do it on the clinical end, somehow we need to find ways for the clinicians to be able to talk to each other, whether it's through tumor boards or huddles or open forums. We need to find ways in which people can connect so they're able to talk both on the clinical side as well as on the administrative side about things that are working and are not working.
Yeah, so how did A Loving Organization come to life? What was the inspiration? Was it anything personal in your life, or just seeing the system as a professional?
Yeah, well, I'll dig a little bit deeper into it since you're encouraging me to. You know what? I've been a performance improvement expert for most of my life. I always think of myself as a quality improvement expert, and I've really enjoyed that role. But in that role, usually what we do is like look at smaller pieces of the puzzle and try to solve those pieces for maximizing the outputs in that arena. It might be something like improving mortality or readmissions. Not that these things are easy, but if we isolate them, then we can work on them. And so it kind of goes back to that impulse we have of breaking things down and trying to look at things in those perspectives. So, we might try to fix the emergency room or the ICU. And those are more examples of performance improvement. Over time, what I realized is that, that is a helpful, those skills and capabilities are helpful. But if that's all we're doing, then we're probably not sufficiently changing the clinical enterprise so that, in a couple of years, as we have turnover, we'll wind up losing all the good effort, and the hospital will probably go back to doing the same things they were doing before. And oftentimes we find that you make some changes. Why don't we fix things like the culture of how we communicate, how we make decisions, how we hold each other accountable, how we create better engagement. So those are more of the culture aspects. And indeed, we found that when we integrated that with our performance improvement work, the work would become more sustainable and more durable. So for a long period of time, I've now also felt like I'm a culture transformation expert. Then to kind of getting back to the personal side of the story, Henrietta, during COVID, I had a little bit of a wake-up call where I felt that I was doing such a good job on the improvement side or the transformation side, but our people were burning out like crazy. And we really started to hear about that, especially during COVID. I mean, burnout's not a new problem. Our staff, our physicians particularly, have been burning out for a long period of time. It's just that people really started paying attention to it during COVID. And that really woke me up, and I said, well, how is it possible that we're fixing things and or fixing the culture, but we're actually burning out our people? So is it that we're actually making the matter worse? So I had a little bit of a crisis of conscience at that time, which made me kind of dig deeper into this over several years. Initially, when I was with a consulting company called Guidehouse, we explored some areas we called empathetic automation, which were about how we use technology, especially robotic process automation, to make the lives easier for physicians and nurses. So that was an initial foray into this work. And then when I came to Premier, I started thinking about more deeply about values-based care. We just started looking at a few organizations, and we realized that they were doing something differently. They were taking better care of their own people, and therefore those people felt more meaning and joy and purpose in their work. And as a result of it, they were more likely to want to engage with each other and collaborate. And that's what was delivering great outcomes across the board. Better quality, better safety, better patient experience, even better profitability. And they were doing it not at the backs of their people. They were actually seeing reduction in burnout and reduction in turnover. So that immediately struck the both of us as like, wow, this is what love feels like if it's in an organization. So we coined that terminology in June of 23, and it really stuck. Because when we would go back and meet with the Loving Organization exemplars at the time that we had identified, and we said, hey, this stuff you're doing, it strikes us as a loving organization, they all immediately stepped back and paid attention and said, wow, we've never heard of this term. We had no idea this was out there. We had no idea other people were doing anything like this. We love it. We wouldn't have necessarily called ourselves that, but what you're describing is very appropriate. We would love to be a part of this in some way. We want to help you. And so we kind of knew at that point that we were on the brink of a social movement. And it largely came about because we were, ourselves a little bit concerned about the state of healthcare systems, and we're looking for another solution. And luckily, we chanced upon these several organizations that were already doing something differently. We're now up to 10 plus Loving Organization exemplars. And I think that that's what gives the energy to our movement, because it's not just a concept, it's not just methodology, it's not just good talk, it's not just ideology. Yeah, we can always point to these 10 and say, hey, don't take our word for it. Look at what all these great organizations are doing and learn from them. And that's what we've been trying to do as good consultants and coaches and executives. We've just been learning from these exemplars and trying to almost reverse engineer their methodologies. How have they become loving organizations? In that process, we've wound up developing a methodology we call Integrate, which is a 9-letter acronym for the 9 systems of an organization. And by doing so, we're able to bring this loving organization concept from a 20,000 foot view, where it's like motherhood and apple pie, and who doesn't like love and who doesn't want to be loving, down to the ground level where people can actually see it and touch it and replicate it, implement it, measure it, and know how they're doing as a loving organization. So that's a little bit of the origin story. Hopefully that came through clearly, but if you'd like to dig into any more of it, let me know.
Thank you. So actually, I didn't realize that it was modeled on already existing loving organizations that were named Loving Organization later by you and others. And so it's even better, because very often when we conceive something just conceptually or theoretically, then people are very skeptical. So then I can see why it's so attractive, because I know I was there from the beginning. I know that it attracted people quickly, and many people. So it grew very quickly. So I can see how that happened. So then it leads to the question: what is a loving organization? How do you define it? What does it look like in practice?
Yeah, so yeah, a great question. And in general, we don't get in deep into the definition around love. What we do try to do is help people understand that it's basically a contrast between the current state and the default state, which is that we have systems in an organization, but we tend to manage those systems through fear. That's just the state of humanity, in 2025, and it's been for decades, centuries, millennia. You would argue that we've always managed ourselves this way. That's what we do. We manage our relationships this way, our families this way, our kids, our spouses, and we manage society this way. So it's not like we're doing something differently in healthcare that we don't do in any other place. And how does that get reflected? It's more top-down, command and control. I'm going to tell you what to do. You're going to do it. If you don't do it, then I'll go through a series of escalations, admonish you and remediate you and then punish you and then maybe move you out of a job. We don't even think about that as fear-based because it's just what we do. But our point is that all of that is really bringing in the elements of fear into the process. And it's not anybody's fault. It's not we versus they. It's not because of the regulators, not because of the insurance companies. It's not because of the executives. We're all in this situation together. All of us are really operating more through competitive mindset and a top-down mindset than we need to and can. If we take those same systems and infuse them instead with love, which is the positive intention of kindness, compassion, empathy, respect, trust, all these things kind of go hand in hand. When we treat people with these positive qualities and infuse these positive qualities into the systems. So by the systems I mentioned, integrate, I should take a step back and describe what integrate is so we can understand what that means. We have, again, it's a 9-letter acronym that stands for all the systems of an organization. There's 4 people-based systems. That's the leadership, community, the staff themselves, and the teams. And then there's 5 process-based systems. So there's management, and then there's culture, technology, workflows, and policies. And when you put those 9 things together, then you kind of get a stacked system that can support itself. And again, if we ensure that each of those sub-elements are managed through love, then you get loving outputs. When they're managed with fear, you get loneliness and burnout and disengagement. But when you manage each of these systems with love, when you create loving workflows, loving policies, loving technology, then ultimately the end result you get is a better cared for workforce that actually feels good about the work that they're doing, is more willing to engage each other and collaborate in the work and deliver all the great outcomes we need from them. So it's not additive. It doesn't feel like yet another burden to people. It's not one more thing that people have to do, which is what's burning people out. It's not a siloed, program or project. It's more about the changing the way in which we operate so that we approach things from that positive intention, and we do it deliberately so that we infuse that positive intention into all of the systems of an organization. So that's really what it is in a nutshell. When we've looked at the exemplars, they're doing very much the same thing. They're looking at their systems and they're trying to figure out how can they make their systems more loving. They're not going back to the individuals of the organization, Dr. Smith and Nurse Mary, and saying, hey, you need to be more loving. We have a compassion deficit, so you need to go and do some more compassion training. They're actually just trying to elevate the entire, operating system by taking the responsibility on the organizational end and by infusing love into the systems. So let me pause there and see if that answers your question.
Yeah, thank you. Actually, it answered more than I expected because thank you for defining us. So when you mentioned the fear and you put fear and love as kind of opposites, and I never thought about them in that way because I'm a biologist, so that's my background, and studying everything, what evolution created and biology and looking at the cause effects, and in that sense, fear is, first of all, it's not really a negative thing, and it's not very often even in human experience. We fear what we love, and we can love what we fear. So there are many different versions. But I really love how you defined it in the context of control. because I think we can definitely say that the control is the main problem. Maybe not necessarily from my point of view, not necessarily the fear, because we can never eliminate fear. Fear has been created by evolution, originally to serve positive purposes, right? So that we can protect ourselves. But as humans, we have a problem with moderating and, seeing the right balance and deciding when to focus on what. And I find it very helpful to bring in the concept of control and put that in the center, and how that is what we want to not necessarily antagonize, but neutralize with love. I also know that some people find the concept of a loving organization controversial, and I know because I was one of them, maybe one of the first. Maybe you remember when we first met, I was asking this question: why to name this as a loving organization? What does it mean in healthcare in the context of a business? And what is love? But I think this really helps to put it in the right context, to focus on control.
Yeah, I appreciate that, Henrietta. Yes, I think I agree with you. I think that when we are talking with people, we find that for one reason why loving organization as a terminology worked for us is it's bold and it's courageous and it's out there on the frontier. And some people are out there on that frontier. Other people talk about love and loving leadership, and some are even willing to talk about loving organizations. But still very much a vanguard type of a concept. People are more comfortable talking now about trust or empathy or compassion or kindness and civility and other forms of it. But that's also shifting. And so we feel like this love language at least helps to push people to think a little bit more differently about what they're trying to do. It helps us to get traction. It helps us to get attention. It helps us to get, it's kind of like from a marketing branding perspective, it helps us to open doors. It helps us to get into conversations with people who all want to understand what is a loving organization. If we were to call it some other kind of an organization, it may still be accurate, but it won't be as attention, getting as loving organization really can be. So that's really probably the number one reason why we've come up with that idea of loving organization. The other ideas, though, are also important. As I said, we thought it would be helpful to set up the simple contrast between love versus fear, because people can get that. And to some extent, control is also, as you were saying, is helpful to think about. But then control already starts to imply that there's a controller and a controllee. And we're not trying to set up that contrast. We really are being very careful, because it's deliberate on our part to say this isn't a problem of a group or individual or a group of people that have kind of tried to control other people. It's not really ultimately a power dynamic. We think of power and control as emerging out of fear. And it's because the fear impulse, although you're right, is a biological impulse and is necessary for survival, but that fear impulse has now become something that we're, using to drive behavior even well outside of any survival mechanisms. And that's what's causing all the challenges, is that it's basically fear that's gone haywire. And that fear all of us are experiencing. The manager's experiencing it, the VP's experiencing it, the CEO's experiencing it, the payer's experiencing it, the staff members experiencing it. So for us, we felt that to set that up as the right contrast was very appropriate, because again, we don't think this is a problem that's going to be solved by blaming one party versus another. And ultimately understanding the root causes of where that fear comes from. You could call that root cause separation, the sense that I and you are different and we want different things. We get down into it at a psychological, biological, and even spiritual level. You could argue that separation is the ultimate, challenge, or you could argue that it's ignorance, the fact that we don't realize that we're all one, because we look different and we are different and we have different bodies and minds. So we start thinking that we are separate from each other. And that's an ignorance that comes in at that point, because it puts us all in the same boat. We all experience fear. We all would, even as much as we need it for certain situations, we generally don't want to experience fear. We try to run away and hide and overcome fear. And we realize that, again, this is not the doing of any one particular individual or group. So that's another big reason why we talk about love, because it helps set up that contrast. And then another reason, which we sometimes don't get into, but maybe we get into here on your show, is that for many of us who are in this work, in this effort, for us, this is a calling. And it comes from a very deep place. It comes from what you might call the spirit or the soul. This isn't just about work and that work needs to get done, or you know, the ego or the mind or the body. This is really coming from a very deep place. And the essence of that deep place, that spirit, or what other people would call the universe, or some might call God, is ultimately the nature of that is love. In all world traditions and wisdom traditions and religions, you look at it across the board, pretty much they all agree that God is love and love is God. And so for us also, we wanted to capture that deep sense that love is really the root from which all of these other amazing humanistic qualities really emerge, like respect and trust and kindness and empathy and compassion. They all kind of have that love at the root of it. So there were a number of reasons, which hopefully we've unpacked a little bit for your audience here today, as to why we think it's a good idea to talk about this as love, even though it may be seen as controversial by some, and some people may feel like we're not ready for it. But at the same time, like you, Henrietta, what we have seen over 2 years of now doing this work is that many, many people, by understanding this and engaging with us and thinking about this, have started to come around. That's the whole point of a social movement. You know, you kind of have to help people understand that there's a different place we can drive to, and that it's all about all of us rather than just one small group of us versus another. So we're trying to, deliberately engineer a social movement that takes all of us to a different place where we can all operate from a deeper sense of love rather than a sense of separation or control or power or ego or ignorance.
So I think many of us probably just sense intuitively, even unconsciously at the beginning, that this is something that is worth engaging in, the Loving Organization, this new movement. And then it gets clarified. You have done a very good job today. Thank you for clarifying the values and how it works and how you think about this. It's very clear, like cause and effect way, how I tend to think. And then we realize that, yes, so it comes together, and so it becomes very clear how it works. I also like to think about fear. Basically, we are as humans, there is a very strong fear of losing control, right? So that's why we want to control everything, because we are afraid of not being in control as humans. That's a big central concept and target also for us at Objective Recovery, because we focus on addiction and addiction recovery, and obviously addiction on the surface in the symptoms, signs and symptoms and behaviors, it's losing control. But people develop as a root cause the addiction, the behaviors, the mindsets, the emotional drives, because they in many ways they are afraid of losing control, and they try to implement coping mechanisms and strategies that still to grasp on that control, the illusion of control. But the problem with addiction is that it doesn't solve it, and something like this is much more productive and much more straightforward. So what do you think that healthcare, because it's very easy to see now how it works and why it works. So why do you think healthcare systems have been historically so resistant to embracing these ideas and the necessity of changing how we think and operate?
Well, I guess that's an interesting way to think about it. I don't know if I would say resistance per se. I think that people in general get set in their ways. And when we get set in our ways, then the systems that we work in get set in our ways, because our systems and our organizations just become reflective of us. Again, I think it's more a function of who we think we are, looking for a little bit more status quo or comfort, or just not being as busy. Change can be difficult and challenging. It can take a lot of work. So I think that in many regards, it's probably just about a reflection of to some extent, equilibrium seeking behavior on the behalf of humans, that we don't always want to be in a state of constant, effort. And certainly in the last several decades, it felt like there's constant change happening in healthcare. So that's one reason why people are also getting burnt out, is because the pace of change is just intense. Workloads are intense, and what people are being asked to do, keeps evolving. So yeah, I don't know if I would say resistance per se, but I think that there's a strong impulses that keep the system anchored towards status quo, which is also another biologic, impulse. It's more about, the preserving equilibrium, and probably in some ways it's a survival mechanism as well, preserving energy. And so that's one thought process I have. The other is that I think a lot of people just don't know. I think that ignorance is really probably the most initial challenge. Is most of us don't realize that there's an alternative. The way we work is the way we work, and it's just the way we've always learned how to work. It's just how we've grown up. It's what we've been taught. It's how our families raised us. It's what we learned in school and college. When did we learn that we really could be loving in an organizational context? Certainly we hear, from our church and from our parents that we should be kind and nice and respectful to each other, but we really have never learned that there's a systems-oriented way to be loving. No, I don't think anyone really has learned that. I certainly didn't learn that when I was growing up. I learned some aspects of love on an individual level, but it really only started to click when I said, well, it's the systems that are necessary that are going to help us move this forward and make this sustainable without putting an undue burden on the individuals. And I think that that's a relatively new concept. There's certainly leaders out there, that have been talking about this for a long time, and the David Dibbles of the world, and Darlene Cuna and Tom Dahlberg, who've been talking about love-driven, systems-based change for a long time. But I think that it's been still a small voices in the midst of, a very large system. And so I think for the most part, the messages haven't really reached the right ear. So at least that's what we're hoping. The whole point of the consortium is to create an awareness and address that very first problem that I'm not loving, I'm not working in a loving organization because I just don't know what it means to be working in a loving organization. I just manage in my typical ways, which tend to be more fear-based, and I don't even realize that that's what it is. So we're trying to spread awareness, shine the light on all these exemplars, tell their stories, do podcasts, write articles, do thought leadership with these folks so that everyone can understand there is an alternative. I think that's the greatest promise of the consortium, is to generally spread the word so more and more people realize that there is something we can do differently. And again, don't take our word for it. Look at the exemplars and think about how they did it, and we can start emulating them. So I kind of think it's more because of lack of awareness, or what we would call ignorance. That's part of it. The second barrier that comes in is usually, okay, now I know that I can be more loving, but I don't know how. So we have to teach them. And so that's another activity that our consortium is engaged with, and trying to create a coaching model and a consulting model so we can help build the capabilities of becoming a loving organization. What are systems? What are loving systems? How do you create loving systems? How do you assess where you are on a spectrum? Comparing yourself to where you were or to others. All of that has to be taught. So that's another, set of barriers that I would say that, that those are capabilities of being a loving leader or a loving organization that we can bring. And then a third barrier to becoming a loving organization is that now I know I could be loving. Now I know how to be loving, but I still am not able to be loving because it takes so much time. Now, we could debate back and forth how much time it really takes, because lots of studies that show that it really doesn't take that much more time to be compassionate. In an individual patient encounter, it might be only 40 seconds. But nevertheless, and when you add it all up, there is a reasonable amount of additional effort that's required if you're a manager to be loving, and you have 20 people that report to you. Well, then being a loving manager means you need to be checking in with those 20 people every week, at least 30 minutes, so you know what's going on with them. That takes time. So there we postulate that what's really required is technology that makes it a lot easier, so that you now know that you can be loving, you know how to be loving, and the technology allows you to scale your loving intent so that it's possible for you to be loving, even though we all carry pretty heavy workloads, in every sphere. So those are the notions that we're trying to build out through the consortium, is to try to address each of these barriers at the different levels, by creating awareness, by creating capabilities, and by creating technologies that can help to solve, some of these challenges for both the clinicians as well as for the managers.
Thank you. So it's not surprising at all, of course, that it's taking time to integrate this, and first of all to accept and then to integrate, because basically it's a form of habit change. Again, I'm speaking from my own, expertise and background. So habit change is always hard for adults. So, and first of all, we have to be convinced. I can take myself again as an example, because part of what I mentioned in the beginning, why and how you and the Loving Organization and the whole community had a positive impact on me. I could very strongly relate to what you just described about how we were trained earlier in life, because it's relatively new, empathy and compassion, and especially integrating it into a business context. So I still grew up especially as a scientist, with that training to focus on, to be a bit detached, and to focus on goals and accomplishments, and just tick, 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 and then get surprised that I developed a lot of mental health issues earlier in my life. And it's very clear to see, it's very easy to see for me now in retrospect, many of the causes that came from that environment. And now a big part of the reason when I first met you and other people in the Loving Organization movement, the positive impact was that I saw a different way of interacting. It's just simply not even thinking about services and coaching and building organizations, but how we interact with each other in that small community. It's good to get reminders, because I still feel that I'm still in the process of that habit change. It's almost like an identity change relative to where we come.
What a great story! I didn't realize you hadn't shared that with me before. I love to hear that story. I'm so glad that it had so much positive impact for you, and that you're noticing that impact and it's continued. And I often say, Henrietta, myself, that the greatest benefit of being in the consortium is to myself, because I feel like through the last couple of years of journey in creating this consortium and the movement, and working with loving people, loving leaders, trying to create loving systems, I feel like I've become more loving also. So I feel just like you, that because of the work that we're engaged with, it helps us to evolve to the kind of place and person that we would like to be. And I think that that's a great sign, because if we can be like that, then we can see that other people can evolve like that, and we can start to see the promise coming together that organizations can actually become like that, through this the similar kind of role modeling and infusion of love into our systems. I love your story. I hope many of our charter members are going to get to hear this, and we should make sure that they get to hear this.
It's a very strong, very easy reinforcement that it's coming from this, because sometimes reinforcement is hard, because not all reinforcement is positive. Even if it's positive reinforcement, it's trying to steer us in a productive direction, but we don't always feel good about it. But it's so easy to feel good about love, and treating each other in a loving way, and communicate respectfully, and with also I would say also good boundaries, because I have been part of many communities, also healthcare related and others. There is a lot of competition and everything, and I have never seen anything like that in this community. So it's easy reinforcement, easy to pick up, from reinforcement, learning, and then apply and maintain the habit. I also would like to ask you, so you spoke a bit about the goals, but can you say a few words about the services? What specific practical services will be part of it?
Sure. Yeah. Thank you. Yeah, I appreciate that a lot. The website for the consortium is www.alovingorganization.org. We've just recently relaunched it. Thanks so much to our colleagues, Dalia Haroon and Catherine Stokes for taking the lead on that. It's really tremendous. Now we have wonderful information. You can come and learn about some of our case studies and exemplars and what we do. Please check it out. And of course, we now have a donate now button as well. So if you're so inclined, please make a small contribution so you can be part of the effort as well, which would be much appreciated. The big thrust of the consortium is, as I mentioned, we are trying to tackle the issue at the level of awareness and ignorance initially. So we want to spread awareness about loving organizations, both as a concept and about the individual loving organization case studies and exemplars. We want to identify as many examples of loving organizations as possible, interview them, get their stories out through podcasts and articles and interviews and such. That's, I think, a very big mission of ours because we think that it's through learning through others, as you were just saying yourself, that the word is really going to spread. This is possible. Now I know. It's possible. There's an alternative to fear-based management. It's love-based management. And now I can see other people doing it and I can learn from them and I can emulate them. So that's mission number one. Around that, we've also want to create a community. So the consortium has really become a home for like-minded people like yourself and myself and many others. We now have about 75 charter members and a bunch of strategic advisors. And they all value the being able to come together and feel like we're not in this on our own. There's many other people like us out there that are also trying to make their organizations more loving or make their clients more loving, and we can learn together and potentially take solutions back into the world to our clients and help make them more loving. So that's a second big function of the consortium, is that community building aspect of it. Then the next big aspect is that we're hoping that organizations will join and they will want to be members, not just as individuals, but as organizational members, so they can learn from each other. How amazing would it be if 4 or 5 loving organizations were coming together and talking to each other about, hey, what are you doing on the nursing side? What are you doing on the HR side? Here's how we've solved the physician, related issues. I think that would really drive a lot of great awareness and momentum. So that's another big offering of ours, is organizational memberships. And then eventually what we hope is that we take this down the pathway of a certification program. So people have already been asking us, how can we get known as a loving organization? It will still take us some time to put that together, but the goal is for us to be able to have a mechanism by which we can help people understand how they are a loving organization. Probably no one's a perfect loving organization. Everyone's always just really going to be on that journey. Maybe it's more accurate to say aspiring loving organization. But people want to know that they're on that journey and how they're doing on that journey. So putting together maturity models and putting together certification mechanisms and criteria, that's a part of where we want our consortium to go down that pathway. Because it's a not-for-profit, we want to kind of really focus on those activities. And then we're setting up a separate, related but separate company that's a for-profit that would be focused on doing consulting and coaching services to help individual organizations that want to become more loving, to help take them on that journey. So that would be a very highly mission-driven company, but it would be a separate company that would engage in the second aspect of what we were talking about, teaching the capabilities to help, when someone knows that they want to be loving, then what do I need to do to be more loving? So that's where some of the coaching and consulting services would come in. And then we're also building out capabilities on the technology front, so we can create what we call loving AI solutions. A little bit at the early stage yet, but we've got a few different ventures that are going in that front to sort of define technologies that can help make the jobs of clinicians easier and help make the jobs of managers easier. So those are the range of services that we're anticipating, not all of them coming out of the consortium, but very much informed by the same mandate and structured so that, the appropriate vehicles can drive them to success.
I'm very glad that you mentioned, especially that you mentioned the technologies and the AI again, because I'm very interested in those. It's kind of my background. And
Yes.
as you know, many people these days are so afraid of the AI, and they almost put humans and AI in opposition, and there will be fights and speculate about the future. And so it's good to hear that a loving organization embraces and understands the value of that and plans to actually integrate that. So I'll be very, very curious to see
Thank
that.
you. Well, it's very ambitious, and certainly we're a fledgling organization. We have a lot of ambition. You know, we want to work on all these fronts. We're trying to work on all these fronts simultaneously. And so people would say it's foolish and foolhardy, and certainly they would say it's ambitious. But I think that what we're finding is that the ambition drives, the progress. And with the ambition, you can now have a vision. The vision creates solutions, it creates momentum, it creates interest, and then it brings in more people who want to contribute to some aspect of the vision. So that brings in energy, and it's through that energy that we really make progress. So ultimately, that's all we're trying to do is lay out the scope for that whole ALO ecosystem, the loving organization ecosystem. We also have products within that ecosystem. These are companies that have created individual tangible products or technology-related solutions that they're trying to sell to individuals or to health systems to make them more loving. So there's a lot that can be done in this space. It's very exciting. Of course, it's daunting at the same time because it's still a small group of people that are trying to take this all on. And I'm grateful to you for giving us an opportunity to talk to your audience so we can get hopefully more people engaged in this work, because that's really what we need. For each and every idea that we have, we're only going to be able to carry it out if we can get more leaders engaged in the work and helping us figure out, well, let me take this piece of it, or let me work on that, or have you thought about this piece, and try to do this in a way that the dots keep connecting back so it feels like a holistic approach rather than, again, a piecemeal approach that's only going to create more stress and dysfunction in the system.
Thank you. I'm so excited to see where it goes in a few years and in the longer run. So last question is, so how can people learn more and get involved if they want? You mentioned the website, and also who should get involved in this? Is it only for healthcare people?
Everyone should get involved is what I would say, right? We all want a loving organization. We all want to work in organizations that are loving. I don't think I've ever really talked to anybody that doesn't. They all value that, even those organizations where they think, well, how is it possible to be loving? We have to pursue the for-profit motive. What we're trying to show is that the for-profit motive goes hand in hand with the loving motive. And in fact, if you're loving, you're more likely to be able to deliver profits in a more sustainable way. So I think everyone should be involved. We're starting in healthcare because we know healthcare needs this. But as I mentioned earlier, this isn't purely a problem limited to healthcare. The challenges, are society-wide, industry-wide. We have technology companies that are interested, educational companies, both K-12 and universities that are interested, banking companies that are interested. So if you're interested and just want to learn more, please join us. The energy leads to more energy. And if we have the right amount of people that are interested in working on a particular problem, then, we can create the focus group and get to it. So look us up, www.alovingorganization.org. Come and find us. Become a member, make a donation, contact us through the organization, or you can contact me at Apurv, APURV, at alovingorganization.org, and I'd be happy to talk to you. We have so many exciting collaborations underway. People are working in all sorts of different spaces, and they're all trying to think, how can we make the work we're doing contributory to this? And that's very, very exciting. So if you're out there listening to this and just curious or want to do something or want to partner or want to explore a new industry, be in touch and let's talk.